Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and I'll be your host today.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we're here with two special guests today. We have Michelle Haney, physical therapist, and we have Melissa McGinnis, physical therapist as well. So tell us a little bit about yourselves, and I know the type of physical therapy you do is a lot different than the average common physical therapy location or place. So tell us a little bit about EURO-PEDS and how what you guys do is different, and even the type of patients that you guys treat.
Sure. So EURO-PEDS is an intensive physical therapy clinic. So we treat children and young adults with cerebral palsy, spina bifida, traumatic brain injury, different genetic disorders. And we're different because we treat in a much longer time frame than traditional therapy. So we will see children up to 4 hours a day, as much as 5 times a week for several weeks at a time. So it's an intensive method that we feel allows the repetition for these children to learn new skills and maintain those skills.
So let's talk about in a normal or average physical therapy place, how long do they treat a patient for? Is it usually an hour or half an hour session?
Yeah, anywhere from a half hour to an hour, once or twice a week is pretty typical.
Okay.
So unfortunately, with that time frame, a lot of times they have to eliminate some of the preparatory work that we feel is really important and cut right down to the functional activities. So to have a longer amount of time to work with the patient, we're really able to help prepare their body and gain range of motion so that they're more successful in moving their bodies.
So you named some of the different conditions, and let's kind of explain a little bit to our audience what some of those things are. So cerebral palsy is something that a lot of people may have heard of, but have no idea what it really is. So could you tell us a little bit for our audience what CP is?
Cerebral palsy is defined as a brain injury that happened before, during, or after birth. And I think that's a common misconception. Everybody thinks that cerebral palsy means that there was a trauma at birth, but that's not always the case. So as a result, you also see very different presentations. It's not a blanket term in that every child with cerebral palsy presents the same way. There's a lot of variation in the presentation. So it's really important because of that, that when we work with them, we have a very individualized treatment plan. Depending on what part of their body is affected, also specifies the type of cerebral palsy they have. So for example, a patient who has diplegia is more affected in the legs compared to a patient with quadriplegia who's more affected in all 4 extremities, or even a patient with hemiplegia where it's more on one side of the body than the other. So that helps us to really focus our treatment, but even though we have a patient with diplegia, there may also still be some involvement in the arms. So that really highlights the importance of a really thorough evaluation when we're writing that treatment plan.
And can you explain to the audience that people with cerebral palsy, they usually have a complete full mental capacity, that it's more of just the motor skills for their arms and their legs. So a lot of people, they hear cerebral palsy, they think it's like a different type of mental disorder. Can you explain that a little bit to the audience as well?
There's also a lot of variation there as well. It actually is more common for someone to have complete mental capacity and more of a physical involvement than the reverse, which, as you said, I think is another misconception. I think another really important piece of that puzzle is the verbal abilities. I think it's really important, and I always, when I have students or I have anyone visiting the clinic, make a point to discuss just because someone can't verbalize or have a conversation with you doesn't mean that they can't understand you.
Yeah.
So that's a really important point for cerebral palsy, I think. Some patients that we see can carry on an age-appropriate conversation. They're doing well in school. They're age-appropriate cognition completely. Others do have some significant involvement cognitively, and others, it's that verbal piece that makes it sometimes hard to figure out. So I really always encourage people to speak to them at age level until you know otherwise.
Exactly.
Because how would you feel if someone was speaking to you as a child and cognitively you were an adult, but you couldn't tell them otherwise?
That's what I wanted the audience to know, because I know there is that misconception and people tend to speak down to these kids and they're 5 years old, they're 5 years old. I mean, some forms of, they're not autistic, they don't have anything, they just have this motor and functional thing going wrong with them, and the audience needs to know that, and people need to know that they do have that full mental capacity most of the time.
And also there's such a big misconception because there is such a big disparity in this type of symptoms. You know, some can walk and talk, some can't walk and talk.
Absolutely.
And so a lot of general population hear the word CP and some of them think, wow, that's someone who can't walk and talk and may have a lot of mental or cognitive problems. And others think, well, it's not so bad. I know someone who's they work in my office and they're
Absolutely.
perfectly normal, you know, so such a big discrepancy. And so the evaluation that you guys do on the children is so important. Is that correct?
Yeah.
And so how does the evaluation process unfold and what does it entail?
It's, as I said, it's very individualized. So we look at the child both by talking with the parent first to kind of get a feel for what the parent wants to see happen, what their goals are for bringing the child to therapy. And that's a point that if the child is cognitively able and verbally able, or maybe with a device able to communicate to me what their goals are for therapy, I make sure to ask the child as well. If I have a 15-year-old who's in therapy, I'm not going to just talk to mom and pretend that they're not there. So we have a discussion about why they came to therapy, what they're looking to improve on, and then we ask a lot of information about their history so that we can really understand all the pieces of the puzzle for them. Their home situation, that may determine what we're working on as far as environments. Is their bedroom upstairs? Is there stairs at school? Is it one level? Is it carpet? Those kind of details also help direct our treatment. And then lastly, of course, we look at the child or the young adult and we see where they're functioning, because our goal is to take every person we see to their next functional level, which obviously varies greatly with what they come to us with. But we really look at where they're functioning now so that we can determine where we're going to take them. And
what age range do you usually work with? What's the low end age and what's the high end age that you guys usually work with?
That varies a lot as well. We used to be, when we first started, more of, I think, a pediatric program where you would typically see, 2 to 18. But the longer we've been around and the more need we've seen, we've really expanded that to be able to help as many people as we can. Obviously, a 2-year-old or a 1-year-old can't do a 4-hour session, which is what some of our sessions are. So then we would tailor it to them and maybe do less days a week or a shorter frequency. But we have seen children as young as 1 or 2 years old, all the way up to young adults and even some adults. As long as we feel like it's a good match, there's gains to be made, and we feel like we're the appropriate person to help with those needs, we're happy to see them. So we don't really have an official cutoff. I mean, we're a pediatric program, so it's primarily children and young adults, but we have seen a couple of adults as well.
Sure.
And now we talked about that. How did EURO-PEDS come about?
Yeah, so there is an intensive approach used commonly over in Eastern Europe. So back in the 90s, there were families traveling over to Poland to get this similar intensive program. And so they would go for 4 weeks to the center and get an intensive program and then return back to the United States. So when we first opened, we actually saw those patients kind of as follow-up from being over there. Mm-hmm. And then we realized, we can do this. I mean, families were saying, we don't need to go over to Poland anymore. So since we opened back in 1999, we have definitely, I feel, strengthened the program because we constantly are looking at new approaches, new techniques out there, and picking and choosing what we think is most appropriate for each child to make their program exactly what they need. Because as we've talked about, children have different needs. Mm-hmm. So.
In this location here in Pontiac, this is the only one in the United States?
Yes, yep, it's the only location we have. We have talked about opening other centers, but we want to make sure that we really perfect what we're doing. Yep. And do the research that's needed to prove to the insurance companies that this is the best treatment approach so that we get appropriate reimbursement before opening other centers.
And you said something about they come for 4 weeks. So these people are coming all around the country to your clinic. Yeah. Tell us about how long the treatment usually is and how intense it is.
Yeah, so the most common amount of time is 2 weeks, especially for the child's first visit. 2 weeks is a really great time for the physical therapist to get to know the child and also for the family and the child to know what to expect. So a lot of times it is a 4-hour program, so it's an outpatient program. So they'll stay in hotels nearby and come into our center. We have different time frames, 9 to 1, 10 to 2, 11 to 3. So they'll come in with us and get their therapy each day and then go back to the hotel and check out the local restaurants and activities. Yeah. So they'll do that.
Like going to camp almost.
Yeah, it really is like a camp. Yeah, absolutely.
And it's all one-on-one?
It is actually sometimes 2-on-1. So we have physical therapy aides that are trained, and they accompany the PT or the PTA and provide hands-on assistance and motivation for these kids, just to really try to get them as actively involved in their session as possible and keep them motivated.
That's incredible, because most of the time, let's say your traditional physical therapist office, they put you on a machine, they walk away, and they have 50 people there with 3 trainers. So to let the audience know that it's called
Totally
PT, but it's a totally different thing.
Yeah.
You're getting one-on-one or 2-on-1 treatment, real intense, 4 weeks. I mean, you must be doing something right to get people to travel across the country. So it's an awesome program.
Reiterate that again. So people are coming all around the whole country. They stay here for a month at a time, bring the child, again, just like camp almost, and they're there every day, 4 hours a day, doing their work, and they leave a whole different person, huh?
Yeah, and as Mel mentioned, our goal is to boost each child to their next functional level. So sometimes we have a kid that's using a walker when they come in. Actually, Mel's patient right now came in using a walker very independently, but she's introduced him to crutches. And so now, yesterday, when he walked to the clinic, because we actually have a hotel that partners with us that's right across the street from our center. So he walked using his crutches.
That's
and
awesome.
is extremely proud.
Yeah.
Yeah.
Yeah, and when I started seeing him a year and a half ago, we got him on that walker because the walker wasn't functional. He had just started doing it, but it was very slow, and they'd been working on it at home. But without that repetition and enough time to practice, you never really get good at a skill unless you can commit the time. It's just like studying for a final exam or learning a new hobby. If you don't commit to work on it every day, it never really becomes more than a hobby. So with gross motor skills, they really need that everyday practice, and that's what this kind of program offers them, to make those kind of changes.
And so with this child, you said he's been seeing you guys for about a year and a half. Are there gaps? They come for the first 2 weeks, then how long are the gaps in between when he had come back for his follow-up sessions?
This child in particular, I believe this was his 4th session in the last year and a half. As far as what's typical, it varies a lot for the families. It is a big undertaking. They're traveling, they're taking time off work, there's the cost of travel and hotel stays possibly. So it varies, as well as what the child needs. Some children come and see us once or twice a year. Some it might be a couple of years, and then they have a procedure or a growth spurt or something drastically changes that brings us back to them, or to us, excuse me. With this boy, they were trying to get him more independent for kindergarten. So they've really spent a lot of time and focus on getting him to us several times over the last year and a half to make these changes that we are now seeing.
Before he starts. Cool.
Yeah.
So let's actually take a look at some of the things that you guys do, as far as the evaluation goes, maybe some of the treatment. We have a little video, and you guys can kind of walk us through some of the things that you do that make EURO-PEDS different than, traditional outpatient physical therapy.
Okay.
So we'll go ahead and we'll roll the video.
So this is an initial evaluation for a little girl. This is her first day of therapy. The physical therapist is evaluating her transitions from the floor and her balance, which you can see is a little shaky. She's taking her up a flight of stairs, and you can see she's having trouble placing her feet. She's kind of dragging them up over the edge a little bit. You'll also notice she doesn't have bracing on during the evaluation, so that we could fully evaluate what her feet are doing while she's standing and walking. But this also pointed out a need to bring in an orthotist. She came in with her walker that you see off screen there, and the therapist was evaluating her with some quad canes. And you can see she's having to help her place not only the canes, but her feet, because this is a totally new skill for her, and it was a bit challenging.
And how old is this girl?
I think that was actually you in the video.
Yeah, I think she was 8, I'm gonna guess. Yeah.
So this is the same little girl. 2 weeks later, you can see much more strength, a lot more balance and stability. She's just standing on her own. We did get her set up with some new braces, which did help with the stability, but you can see in her core too, her alignment's totally different. We're back on the stairs again, and now she's even got ankle weights, and she's clearing the stairs much better. Her movement's much more controlled, and the therapist is only helping her a little bit at the hips for safety instead of around the torso as she was before. And now we see her walking, and instead of with those quad canes that we saw, she's now in a single tip crutch, and she's placing her feet and her canes by herself, concentrating, but she's doing it by herself. a lot of big changes for 10 days of therapy.
You can see she has the pattern down really well.
Yeah.
Which is excellent.
Oh, here she goes, no crutches.
Yeah. A couple independent steps to show off her progress.
And that's only in 10 days.
Yep. 10 days of 4-hour sessions.
That's very impressive. I thought it was really cool. You could see such alignment changes too, and obviously that's our bread and butter. We work on the spine and the joints and normal healthy alignment. So that to me was very impressive. Just to see her posture, her standing more upright.
Yeah.
What's
Very
cool is that it happened in 10 days and it was intense. I've been talking to my patients because as a chiropractor, we're looking to realign the spine into its proper position. And people are like, okay, I want one visit and get it back to normal. And I compare it to like an orthodontist. You wear your braces 24 hours a day, 7 days a week, 365 days a year, even on 366 sometimes also. And that's for 2 to 3 years, every day, 24 hours a day, to move teeth, which are important, but they're not that important.
Yeah.
I mean, they're there for chewing food, but to get a spine back, I have a few minutes, maybe once or twice a week, to work on the alignment, and they expect miracles. So it's good to understand that things take time. So getting that 4 hours one-on-one training, and you can see the results right there, not 30 minutes by yourself with a guy watching over you.
Yeah.
So it's, again, it's an amazing program, and I want to thank you for having it for these children to be able to go to and send kids to you.
Thank you.
And one thing we see too, like you said, the misconception, people come to us all the time saying, fix me today, is their symptoms aren't necessarily that bad for as long. They may have had a structural problem for a long time and they just started feeling symptoms when they decide to come to us. So now with some of these children, obviously their symptoms are, that their gait is off and that they, can't move, but do a lot of them have pain as well?
Yes, it's always a little bit of a difficult thing to assess because so many of our kids are nonverbal or limited verbally. And I feel like, me personally, even the children that do have pain, they have such a high pain tolerance because of high tone and spasms. It's what they've always known. So I don't necessarily have a child who tells me something hurts very often, but you can tell with the way that they move or the way they respond when we're doing massage, for example, and we're working out that tightness, that there is some discomfort there.
Even certain ranges of motion, correct? I've noticed that with some of our patients too, that maybe nonverbal, or even not with some of these conditions, but even some autistic children, certain ranges of motion, they kind of may grimace or wince a little bit without necessarily saying it or mentioning that, wow, this hurts. And so we see different with adults. A lot of times adults don't seek treatment until their pain gets worse and worse. And then they think, wow, we should fix this instantly, when to change the structure, it takes time and repetition.
Yeah.
And it's good to get to these places beforehand. I mean, for you, you're dealing with patients that you said they were born with these issues most of the time. But you also said something that some of these, there's a trauma that has occurred. What would you say your percentage of kids are normally born with CP compared to a trauma after the birth?
The kids we see, the majority really have been born with something. So I would say probably 90%.
Yeah.
And then, 10% traumatic brain injury. So we do see children that have been in car accidents or near drownings.
And do you notice a difference in the results for the kids that were born with it compared to something that happened later on?
Every child's so different.
Yeah.
So I think it just depends. It depends on what skills they had before the injury, if it's a traumatic brain injury, and how severe the traumatic brain injury was. So sometimes those children are able to recover faster because their bodies have done those movements before. With the kids that have been born with a disability, a lot of times they're developmentally delayed, so they've never done it before. We're teaching them how to do it for the first time. So just like a baby, typically developing baby who's learning to stand up, they'll stand up, fall down, over and over. So for our children, we just need to increase the amount of repetition for them to really master that skill.
That's cool.
And do you guys see children that have had maybe strokes too?
Yes.
Strokes,
Yeah.
like in the womb they have strokes?
Yeah.
And so before they come out, they already have had some of this damage, right?
Yeah.
And it varies a lot depending on, I think, how much therapy they've had too before they come to us, how high their tone is. There's all these different pieces of the puzzle. If they're older and they've had high tone for a lot of years, there's a lot more orthopedic pieces of the puzzle that we have to address before we can do function. And we do, with seeing all ages, we have some kids that have been in therapy since they were little, and some kids that are teenagers and have had very little therapy, but they all make gains. That's the beautiful thing about the repetition and the intensity, is we've had kids come as adolescents who've had very little therapy, and their parents think, oh, it's too late, I wish this would have been around when my kid was little, but they still make amazing progress.
Yeah.
Now, do you guys get most of your patients from physicians and hospitals, or more from patient referrals from people around the country that just are in support groups, or they're in nowadays Facebook groups, so they just say in the group that they went here, and then everyone looks into it.
Yeah.
Do you get some of each, or?
We do get some of each, but definitely word of mouth, I think, is our the largest amount of patients, and definitely the internet. It's amazing. I think back to the families, 20, 30 years ago that didn't have the internet to turn to, and it was a lot more difficult to get information. So we do have a presence online, and I think families, share information that way. But we work with PTs across the country, chiropractors, physicians. We get referrals from all different healthcare
Because it can be
providers.
anywhere. It's not like you're
Yeah.
local,
Yeah.
We see patients somewhat close to our office because
Yeah.
of time and repetition, but, I see some that have come a couple hours, but no more than that. We don't see people from around the country. But that's really cool that you get referrals from other physical therapists.
Let's
I'll
go
work with
through like
patients.
a step-by-step. Like, is there a pre-approval? Like, obviously not everybody's coming to you. So you say you're getting a lot of referrals, but what is like the process of getting into EURO-PEDS? Like, do you guys take insurance, and how does that process go?
Yeah, so the first step is to fill out a patient application. So in that application, we ask a lot about their medical history. I review those applications, and if I see anything that I have questions about, I pick up the phone and call the family and just get some clarity. So just to give you some examples, if there's cardiac concerns, if they're following, with a cardiologist, I'm going to ask a few more questions about that. I'm going to ask about their seizure activity. A lot of the kids we work with have seizures, but I want to make sure that they're regular, they're controlled, and we kind of know what to expect. And most of the time, the families are really aware and know exactly how to handle them. They're either on medication or maybe the ketogenic diet, so it's controlled in some way. Occasionally, there will be a child who's filled out an application that has a new onset seizure disorder. So I'm probably going to recommend at that point that they hold off
See
on
the
intensive
neurologist
therapy,
first, get it under control
until
first.
we make sure that it's a safe
They can
option.
handle it.
So, so once we go through the medical history, if we feel like we can help them, and the majority of applications are approved, then I contact the family, let them know. On the application, they also give their insurance information. So our office is able to, as a courtesy, verify their insurance and let them know what we were told. We encourage them to also check on their end, and then we compare notes and see if we got the same answer. And if we didn't, we call again until we are confident, we know what their out-of-pocket would be. So they know before they come, what to expect. If there's an out-of-pocket, we're really excited. In the past couple of years, we have worked hard to open a EURO-PEDS Foundation.
Awesome.
And that foundation raises money and awards treatment and travel grants for families that do have out-of-pocket costs. So, even if they have a high deductible or high co-insurance, they can apply for a grant.
How do they go about that? They apply for it, and you give grants or scholarships.
Yeah, so
based on
similar
need?
to getting into the program, the clinic, there's a separate grant application from the EURO-PEDS Foundation. So they would fill that out. They explained what their need is and just give them some background on their family situation. And then the EURO-PEDS Foundation Grant Committee reviews the applications and then decides, what amount to award the family.
That's incredible.
Now, when they do their initial intake, do they send you a stack of records this big? Do you guys, or is that once you've accepted them as a patient, you look through everything that you, from the neurologist, or if they had seen chiropractors or physical therapists or whatever, you guys get some records from them?
Sometimes we do. We don't require it unless we have a concern.
Sure.
There's some therapists or healthcare professionals that really want to stay involved and will send their stuff, which is helpful. So we do get to review, some of the records. One thing that we do take a close look at, if they're going to do suit therapy, which is an optional part of our program, is hip x-rays and spine x-rays. So we do want to make sure that their hips and their spine are aligned well enough to go into the suit. So the suit does provide compression to the body. We want to make sure that it's a safe option for them.
And we'll talk more about the suit next time and some of the contraindications and stuff like that as well. That's really cool. I can't wait to show our audience what the suit entails.
The question that I'm sure everyone's wondering, how long does it take beforehand? Like if someone calls up, a patient is watching this video and says, wow, my kid probably will qualify for this, how much advance notice? Because I know you are doing one-on-one or two-on-one training, so there's got to be some sort of wait limit. I mean, yes, waiting time.
List. Yeah.
Waiting list, there we go.
Yeah, it really depends. You know, we're also working with the family. So if they're open, they're ready to come to Michigan, you know, as soon as they can, then, you know, it depends on what time of year. Summer is very busy. The kids are out of school, so we have a lot of families that travel to our program in the summer months. But in the winter months, sometimes families aren't as eager to travel through the snow and cold. So they will probably get in faster, you know, this time of year in the colder months. But it really just depends on their flexibility as well. If their child naps at 2 o'clock, so they definitely need that 9 to 1. Well, we have 2 therapists that do that out of the 6. So those are the kind of factors that may influence them waiting a little bit longer. A lot of times our returning patients would like to be with the same therapist that they were with the last time. So then it just depends on their schedule.
They may have to wait. Because it's such highly specially trained therapists there, it's not like you can just bring an extra couple of people on for this week or anything, right?
What kind of excessive training did you have to go through before you could start working at EURO-PEDS?
Well, we do all of our training in-house because in the state of Michigan, you're licensed by the state, but it's in general PT practice. And me personally, every program is different, but the university I attended didn't have a really heavy pediatrics background, and I don't think many of them do because it's such a kind of a niche area. So we do a lot of mentoring when a new staff member starts. Anywhere from 4 to 8 weeks they'll spend with a therapist learning about the equipment, which is also not something we get in school because it's from Poland. So there's a lot of time spent with another therapist before they get their own patients for training. And then even once they do get their own patients, we're a tight team, so you can always turn to someone and ask
Everyone
questions.
knows what's going on with every other patient in the clinic. That's awesome.
That's very cool.
So thank you ladies so much for joining us. It's been very educational, very informative, and hopefully this can help the community understand a little bit more about some of these children, some of the conditions, help physicians like us to help refer to places like yours as well. So thank you very much for joining us. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, your host for Ask the Chiropractor.
And I'm Dr. Ruvayn Rubinstein, your co-host out of Troy, Michigan.
Stay healthy.